Medical Law and Ethics. Welcome to Unit 2, Medical Law and Ethics. In this section of the units, we will cover information relating to the requirements and entries for medical records. Behavioral objectives. You should be able to identify at the end of this unit the governmental and private entities that establish medical records requirements. You should also be able to list the types of information in a patient's record. As well, explain why it is important for a record to be complete and accurate. Discuss the role of the Center for Medicare and Medicaid with regard to medical records content and retention. Give examples of the information that state law may require in the medical record. List the sources of law governing medical records retention. Recommend consideration for medical records destruction policy. Behavior objectives continued. You should illustrate how legibility and accuracy are important to the quality of medical records. Give examples of how entry errors and poor legibility can create difficulties in the long term. Discuss the standards that govern the completeness, accuracy, and legibility of medical records. Behavioral objectives continued. Define what timelines mean with respect to medical records entries and the consequences of failing to comply with timeliness standards. Discuss how verbal orders affect the quality of medical records. List the types of errors that occur in medical records entries. And as well, define auto-authentication and recommend safeguards for the systems. Terms. Legal health record, or LHR. The legal business record generated at or for a healthcare organization. AHIMA defines the legal record as the documentation of healthcare services provided to an individual during any aspect of health care delivery in any type of healthcare organization. It is consumer or patient-centric. The legal health record contains individually identifiable data sorted on any medium, collected and directly used in documenting health status. AHIMA, American Health Information Management Association. Conditions of participation are those rules governing the eligibility of someone or of an entity to be involved in a particular activity or organization for medical records. This involves the CMS, or the Centers for Medicare and Medicaid. Legibility. The ability in written form to be read. Auto-authentication. The physician authenticates a report electronically before the report is transcribed by entering a computer code. The Joint Commission, or TJC, is an accrediting body which has requirements for medical records. Medical records. One of the most pressing problems for healthcare organizations is what to do with records. How should they be stored? What laws govern retention? Records that must be kept are established in numerous ways. The healthcare organization must be aware of what state licensure regulations are for their type of agency. Accreditation standards are set by such organizations as TJC or the Joint Commission and NCQA or the National Committee for Quality Assurance. Professional associations for specialties such as cardiac surgery, for instance, may also set medical record standards. Medicare Conditions of Participation also sets retention standards. Medical records continue. Determining which type of records are kept should be governed by policies established by the organization based on the laws and regulations governing retention. Policies should include the type of information included in the records, the length of time the record is to be retained, and the proper method of destruction of the type of record, whether microfilm, paper, or electronic. Types of data. Types of data contained in the medical record include the following: personal data or demographic information such as sex, marital status, residence, and other forms of demographic information. Financial data. This encompasses insurance information and employer information, social information, your race and ethnicity, family relationships, lifestyle, court orders or other legal documents. Medical data. This is your record of treatment. The complete medical record. The complete medical record may stand alone in a court case where the information contained within it is challenged. The axiom that if it wasn't charted, it wasn't done, is the basis for professional negligence claims in many suits. A complete record that tends to improve the quality of care that is given to patients. The complete medical record will in fact contain the following items: a complete documentation of care given to the patient, the treatment plan and care plan, and then the evaluation of that treatment, the communication between the providers of care, such as progress notes and nurses' notes. Definition of a medical record that is legal. Definition of a legal medical record. The documentation of healthcare services provided to an individual during any aspect of healthcare delivery in any type of organization. Each healthcare organization is responsible for developing the guidelines for the legal medical records within their agency according to the needs of that agency. Medical record formats. Medical record formats are the traditional paper format, the newer electronic health record or EHR, and the hybrid format, which is a combination of the paper and electronic formats. Issues in the legal medical record. With the rapid changes that have been occurring in the formats of medical records, there are some concerns about whether the following should be included in those records. For instance, pop-ups, alerts, or reminders in electronic health records, audio files, video files, and the personal health record. Record retention. Record retention is initially determined by the relevant particular state and federal laws. Space constraints are a large concern for the organization and may determine how the records are retained and stored. The resources available to the organization, as well as the requirements of liability insurance, also influence the decision-making process related to record retention. Statutory requirements for retention. Medicare conditions of participation require that records are retained for 5 years. As well established, the individual states may have their own requirements and regulation, and this applies to record retention as well. In the case of minor patients, the age of majority plus a specified number of years is usually the rule. AHIMA retention recommendations. Medical records for adults, according to the AHIMA, should be retained for 10 years after the last date of visit. For minors, it is the age of majority, which differs in most states, plus the statutes of limitations. For diagnostic images, 5 years. For the disease index, it's 10 years. And for fetal heart monitor records, it's 10 years after the age of majority, again determined by the state. AHIMA retention recommendations continue. For the MPI, or the Master Patient Index, the records are permanently contained in the retention system. For the Operative and Physician Index, it's 10 years. The birth and death records and registers and the Surgical Procedures Register are records that are kept permanently. Destruction of records. The destruction of records in any healthcare organization must be done in the normal course of a business day or business cycle. The destruction of the records is governed by the relevant state law. HIPAA requires that the business associate agreement also be governed by the same rules and regulations. Methods of destruction. Microfilm is pulverized and recycled. Magnetic disks or magnetic data is degaussed to erase the data. Laser disks as well are pulverized. Paper is either shredded or burned. The healthcare organization must keep a record of what information is destroyed, including the date and time of the destruction. Medical record entries. Guidelines for medical records entries. Entries into the records need to be clear. That is, without smudges in the case of paper records, and in an understandable language, a common or standard medical terminology. Ambiguity or illegible records may negatively impact the quality of care that a patient receives and may lead to suit. The record must document all of the care that is given to a patient or client. If it isn't documented, then it wasn't done. Electronic health records present a number of problems, with the standardization of entries being most prominent. Medical record entries. The record itself represents the billing portion of the healthcare organization's operation. Accurate medical record entry will defend the healthcare organization from fraud and abuse charges. HIPAA defines fraud as knowingly and willfully executing or attempting to execute a scheme or artifice to defraud any healthcare benefit program, or to obtain by means of false or fraudulent pretenses, representations, or promises of any of the money owned by or under the custody or control of any healthcare benefit program. Medical record entries continued. Fraud and abuse charges in federal programs, such as Medicare and Medicaid, are investigated by the OIG, or the Office of Inspector General. Legible and complete records are part of the requirements for the following organizations: the Joint Commission, or TJC, Medicare Conditions of Participation, legal statutes from the government, and some professional organizations which will in fact oversee some of the charting for the medical record entry in order to attain accreditation. Timelines. Timelines and timing is extremely important legally in terms of the medical record. Entries made well after the event occurs are subject to error and misrepresentation based on memory. All entries should be made when the care is given or the observation is made. This should also be within the time limits established by rules and regulations. Late entries are discouraged and are assumed by the courts to be post hoc or after the fact and thus suspect. Physicians have timelines in which they must complete their records. This has been difficult to enforce. Signatures. Signatures validate the document. Signatures must also be verifiable. Each organization is required to have a policy related to signature documentation in the medical record. The organization must also have a policy on each professional's scope of practice. Signature policies must also regulate the need for countersignatures and for whom. Authentication. Requiring the healthcare practitioner to sign the record ensures authenticity. The HIPAA security rule provides standards to ensure authenticity. The integrity standard and the person or entity authentication standard are the two standards that are particularly relevant in terms of EPI, or Electronic Protected Health Information. Medicare conditions of participation require that all entries are to be dated and signed immediately. State law may allow authentication by rubber stamp or computer key, as well as the traditional written signature. Auto-authentication. In auto-authentication, the physician enters a computer code to sign a report before the transcription has been done. The physician agrees to review the report within specified timelines. This has been difficult due to physicians complying with the timelines in a not timely fashion. Verbal orders. Each healthcare organization must develop standards governing how the verbal orders are received and recorded. Verbal orders should only be given if they are unavoidable. Written orders or computer entry orders are preferred. Each state has hospital licensing regulations that require the signature of the physician on the order, whether it is verbal or written. The Joint Commission requires in their standards of accreditation that hospitals have regulations on how verbal orders may be accepted and transcribed. Corrections and alterations. Types of errors. Minor types of errors are typographical errors. Significant errors are order entry errors or omission of information. And again, there are always variations in state law. I think that's one of the things that we've learned from the beginning of this unit, is that state laws are variable. Corrections and alterations. The proper method for correcting a written record is to draw a line through the error, write the corrected information, and initial the correction with your personal initials. The person correcting the error must also enter the date and time the correction was made. This is a legal requirement. Corrections and alterations continued. The proper method for electronic record correction is to retain the original documentation, including the date and timestamp, and then enter the corrected information and record the new date and time. Corrections and alterations continued. Patients may want to correct information in their own records. HIPAA allows the patient to request an amendment to their record. The amendment may be denied by the organization, but the patient must be given an explanation as to why this was denied. If there are legal issues with the record, consulting an attorney before amending the record is desirable to prevent suit.